students, welcome to this session. So now I will start the topic biomedical waste management. So these are the learning objectives of this topic, that is definition and classification of biomedical wastes, then health hazards associated with biomedical waste, treatment and disposal of biomedical waste, and finally legislation for biomedical waste management. So this topic is also spread over 3 units. So unit 1 I will discuss now, biomedical waste management in general, covering CBME competencies 14.1 and 14.3. So what is biomedical waste? The definition has been given as any waste which is generated during care of human beings or animals. It can be in the process of diagnosis, treatment, immunization, or research activities also, production or testing of biological products, and in health camps conducting outreach service sessions. So amount of biomedical waste generated is approximately 1.5 kg per bed per day. Still, this is a variable amount. It depends on the number of beds in the health facility, the amount of utilization of the healthcare facility, etc. And also the amount of disposable items used, because that will increase the load of the healthcare waste. So the waste, as you see here, major part of it is general waste. 85% is general waste. Only 15% is biomedical or hazardous waste. So out of that, 10% is infectious and 5% is non-infectious but hazardous waste. So importance of this is that if this amount of general waste is mixed with this amount, so the whole thing becomes voluminous and incurs a lot of cost and time to dispose that off. So it is best to segregate so that we have to deal with only this part and the rest of it can go along with municipal waste. So these are the sources of biomedical waste in a healthcare facility. It can be from inpatient, outpatient, immunization clinic, laboratories, dental clinic, blood bank, mortuary, animal houses, etc. So these are the health hazards of biomedical waste, and this picture shows the various ways biomedical waste can be hazardous to human health. So firstly, here through injection, needles, syringes, HIV, hepatitis B and C, TB, etc. can spread. Secondly is untreated hospital liquid waste. If discharged into water bodies, they can contaminate the water there and be hazardous to human health. Then when waste is burned in incinerator, the smoke that comes out pollutes the air and again is hazardous to health because of air pollution. Then infection acquired from hospital. This is a very huge contribution to the total overall health hazard. Then finally, if biomedical waste is thrown around, strewn all over, and people are scavenging from it for retrieving reusable materials, or animals are looking into that for search of food. So through them also the hazards can spread. So who are the population at risk? The healthcare workers, of course, doctors, nurses, paramedical workers, other support staff. Then sanitation workers, they are also much at risk. Those who are in the cleaning process, maintaining cleanliness of the area. And those who are involved in waste disposal, they are at high risk. Other than that, patients are also at high risk of developing diseases through hospital wastes. And that can be through outpatient department, through indoor admission, those who are admitted. And along with the patients, the attendants of the patients are also at risk. The scavengers, I have already talked about them, they are at risk. And the general population is also at risk through air pollution, water pollution, etc. So these are a few examples of health hazards of biomedical waste. So infectious waste can lead to hepatitis B, C, HIV, etc. Chemical and pharmaceutical waste, they can cause poisoning, cancer, etc. Radioactive wastes can cause acute or chronic radiation exposure hazard. So how can health hazards from biomedical waste be prevented? Can be prevented through multi-pronged strategy. First of all, proper handling, proper management, that is treatment and disposal. Then the personal protective equipment are very important in protecting the person who is handling the waste. Standard precautions need to be taken, I'll talk about that. And there is a very good legislation which should be stringently followed. So personal protective equipment, you can see here, the head cap, face mask, hand gloves, aprons, safety shoes, etc. All these fully clad. Now in the context of COVID-19 disease, you have seen how PPE kits are worn, because this is a very contagious disease, so to prevent that. And similarly, PPE kits need to be worn while handling biomedical waste also. Standard precautions I mentioned is one of the strategies for prevention of hazards due to biomedical waste. And in fact, it is a strategy for prevention of hospital-acquired infection. So it follows that all body waste should be assumed to contain infectious transmissible agents. And so body substances include blood, peritoneal fluid, secretions like sputum, saliva, excretions like urine, feces, then non-intact skin, open wound, if there is an open wound on the skin, so that also can transmit as well as acquire infections, and mucous membranes are also very prone to acquiring or transmitting infection. So following standard precautions to prevent transmission through these. Measures include hand hygiene, the use of protective barriers, safe injection practices, and disinfection or sterilization of reusable equipments, and proper disposal of biomedical waste. Now I'll discuss the legislation in brief, just an introduction, and in the next unit I will continue with details of all the measures under it. So this legislation, it is under the Ministry of Environment, Forest and Climate Change. It was first formulated and enforced in 1998 as the Biomedical Waste Management and Handling Rules, and it was subsequently amended quite a few times. Finally, now in 2016, it has been renamed as the Biomedical Waste Management Rules, which has further been amended in 2019. So these rules apply to all persons who are involved in management of biomedical waste in any form. So either to generate, where it is being generated, or where it is being collected, received, stored, transported, treated, disposed of, everything. Everybody who is involved in any one of the processes of or steps of biomedical waste management is at risk, and this rule applies to all of them. And these rules, it does not include radioactive waste, hazardous waste, e-waste. They come under separate rules and laws. So biomedical waste management rules apply to hospitals, nursing homes, clinics, dispensaries, that is healthcare facilities. Then laboratories, blood banks, forensic laboratory, research institutes, research laboratories, veterinary institutions, animal houses, even Ayush hospitals, and also to health camps. Health camps are outreach sessions that are held for providing healthcare services. There also a lot of biomedical waste is generated, which should be brought back and properly managed. So these also come under these rules. And educational institutions like schools, colleges, or workplaces also, they often have, most of them in fact, they have first aid rooms for care of the sick. And those also come under the purview of these rules. So biomedical waste management. I'll start with first blood or body fluid spill management, because blood, body fluid being liquid, they sometimes spill over onto surfaces, say on tables or on floors. So how should that be managed? Because they are potential sources of infection spread. So first of all, the area where spill has happened should be cordoned off so that people do not come in and step on that and spread it further. So cordon off the area. Then the person who is going to handle this should wear gloves and other PPE as required. After that starts the process. So with absorbent material, the spill, the liquid that is there, should be wiped off starting from outside inwards. So this way it should be wiped off, and then the absorbent material, soiled material, should be discarded in yellow bin. Then the spill area should be covered with sodium hypochlorite solution, because this is disinfectant, and left for 20 minutes. After that, again with another fresh absorbent material, wipe off the area again from outside inwards and throw that in the yellow bin. Subsequently, dry with another fresh absorbent material, and then wash the area with detergent, and discard the gloves in red bin. If the gloves are recyclable, then discard that in red bin. And finally, wash the hand properly with soap and water. So this is a picture of that, what happens. See, this is the spill, how it is cordoned off and cautioned so that people understand they are not supposed to go there. Then gloves, PPE has been worn. This is PPE has been worn. And then this is wiping off from outside inwards this way. If this is the spill, it is wiped off. And then this is sodium hypochlorite solution, disinfectant spread there. And after that again wiped off from outside inwards and discarded into yellow bin. Here also discarded into yellow bin. So now next is the solid biomedical wastes, which have to be collected, contained, stored and then disposed of. So they are in containers or bags. So all containers, bags that are involved in biomedical waste management should have this biohazard symbol. So this is a biohazard symbol, this is a cytotoxic hazard symbol. And these are very important again for your practical spots, because this will be shown, of course, without this label, this writing here, and you have to identify what this is, and a few related questions will be asked on that. So now steps of biomedical waste management. First is categorization, segregation, collection, storage, transportation, treatment, and finally disposal. So this is the flow of the biomedical waste. This is the healthcare facility where the waste is generated. The liquid flow is managed this here, and then the solid waste. The segregation is done at the point of generation. Subsequently collection, then transportation, in-house transportation. That means from the point of origin to the storehouse, wherever it is stored.